Hello everyone, I am Dr. Veena Aurangabadwala. I am a consultant obstetrician and gynecologist at Zen Multispecialty Hospital, Chembur. On the eve of the World Cancer Day, which is celebrated every year on the 4th of Feb, I would like to highlight about cervical cancer. The cervical cancer is a cancer of the mouth of the uterus, which is otherwise known as the cervix. Cervical cancer is a very rapidly growing cancer in India, although it is highly underrated. Cervical cancer usually is found in the age group of 40 to 65 years of age. Women who have multiple sexual partners, those who've had multiple pregnancies, or who've been using long-term birth control pills are found to be at higher risk of cervical cancer. Cervical cancer usually presents or begins with very mild and subtle symptoms such as excessive white discharge per vagina, abnormal vaginal bleeding, bleeding after an intercourse, or lower abdominal pain, which are many a times gone unnoticed or delayed. A simple ultrasound of the abdomen or a pelvis cannot detect a possible cervical growth or a mass, and hence many a times cervical cancers are detected at a late stage. Cervical cancer can be treated but with great difficulty, hence the best way to reduce the incidence of cervical cancer is to prevent it. There are different ways in which we can prevent cervical cancer. One of them is the primary prevention, the other is the secondary prevention. The primary prevention is to limit or use safe sex practices such as limiting the number of sexual partners, using barrier contraceptives such as vaginal diaphragms or condoms during intercourse. Also, the other way of preventing cervical cancer is to take the cervical cancer vaccine, otherwise known as the human papilloma virus vaccine, which is easily available in India. The ideal age of taking the vaccine is between 9 to 15 years of age, although women up to 26 years of age can take the vaccine. Women can even take this vaccine before their first sexual contact, even though it is after 26 years of age. The other way of preventing cervical cancer is the secondary prevention. By secondary prevention, I mean early detection and treatment. The way to detect cancer early is by performing screening tests. For cervical cancer, there are screening tests available, which is better known as a pap smear. This pap smear can be done on a yearly or a 3-yearly basis. Other ways of screening for cervical cancers are known as colposcopy. Please ask and consult your gynecologist regarding the pap smear or the colposcopy, or for detection of HPV DNA. But these are screening tests and therefore they are not 100% definitive treatment or detection of cervical cancer. The best way or definitely to detect cervical cancer is to do a cervical biopsy, which if required can be done at the earliest stage so that the cervical cancer or changes in the cervix can be picked up at the earliest stage possible and the best treatment could be started. I'd like to thank you for a patient listening, and I wish you all a safe and healthy year ahead. Thank you.